My name is Chris Draenos. I use he, him pronouns. I'm going to be discussing the preliminary results from the Test at Home program. As a national organization, the work of CBRC spans across the unceded, ancestral, and traditional territories of First Nations, Métis, and Inuit on land that is currently occupied and known as Canada. We recognize and are grateful for living and working on these lands that have been cared for by Indigenous people since time immemorial. I am situated on the traditional territories of the Wendat, Anishinaabe, Haudenosaunee, Métis, and Mississaugas of the Credit First Nation in what is commonly referred to as Toronto. Some acknowledgements. None of this work could be done without the community members who generously spent time to provide the data for this work, as well the CBRC research team and Test Now Buddies. It takes a team to do everything. As well, we have some community advisors who provided input on the design, questionnaire, and promotion of this work. We have a variety of community partners who have supported the work, as well as research affiliates who are academics from across Turtle Island, and ReachNexus that provided funding for this work. So it's now Test at Home, happened in 2021. It was an optional, so the Test at Home program was an optional sub-study of Sex Now 2021. It ran from April until September, and the follow-up will continue until February of next year. Data presented is preliminary, and our research goals was examining uptake and acceptability of HIV self-testing and an HIV self-test program amongst LGBTQ people nationally, and the feasibility of male home HIV self-test and sexual social network distribution of HIV self-tests. I'll present some data on who participated. And so we had 2,272 participants, which was 38% of all Sex Now participants who reached that point in the survey. We delivered over 5,000 HIV self-test kits by mail, and we have thus collected information so far that 256 self-tests have been provided to the sexual social networks of our participants. When we look at who participated by province, there was a bit of overrepresentation amongst Atlantic provinces, particularly Nova Scotia, in terms of who participated, and a bit less amongst the prairies, and that was Alberta. The majority came from Ontario, and even though there was interest from Quebec in Sex Now, it's a little bit less than the population breakdown of Canada. In terms of the age of participants, youth were more likely to participate. However, the bulk of our study participants were in the 31 to 59 year category. We had good representation amongst folks who represent gender diversity. We did an analysis on trans and two-spirit folks as well, and there wasn't actually any significant difference in participation due to those factors. When it comes to sexual identity, queer, pan, and gay men and non-binary people were the most likely to participate, whereas there's some still barriers from bisexual and straight men who have sex with men. We had good representation amongst people who identified as a person of color. However, there was less uptake than hoped for amongst Black and African folks. And so we'll need to do further work with the community to understand why that might be and how we can better support those folks. While there was hope that the urban and rural areas would have good, high uptake of the HIV self-test program, it was actually the urban core and the urban areas, and to a lesser extent, remote areas where we had greater uptake. So we do need to understand a little bit more about why that may have occurred. And when we look at some behavioral indicators, folks who had never tested were actually the least likely to participate in this program, and represented only about 10% of the sample of folks who did participate, whereas people who had experienced barriers to testing since COVID were 2.5 times more likely to participate than if they hadn't. And we look at some clinical indications for PrEP. Those who had gonorrhea, chlamydia in their bum, syphilis, or have injected drugs in the past 6 months were significantly more likely to want to participate, about 1.5 times more likely than those who had not had that experience. In terms of the actual program and HIV self-test experiences, we had very high satisfaction with the program, as well as the mail home aspect of it. And so we were quite pleased with how this community design project was able to meet a community need. When people were asked about the benefits of the program, convenience, privacy were actually the majority of the reason why people liked it. And the peer support aspect was actually less popular. However, when we look at the drawbacks, more than about 50% of people said that there were no drawbacks, and a minority of folks identified a few issues, such as worrying about the test result, worrying about the reliability of the HIV self-test itself, or just preferring an MD to a nurse. Just on the Test Now Buddies, just to clarify, folks were very satisfied with the buddies when they did interact with them, and were quite happy with how they were able to access the Test Now Buddies, which included a toll-free number to call, text, or email. For the HIV self-test itself, 2/3 of folks preferred HIV self-testing to standard testing. About 20% said it was about the same. 88% of participants are somewhat or very likely to use HIV self-testing again, and there was very high acceptability in terms of ease of use and overall experience using the HIV self-tests. People generally wanted to just use the test by themselves, and while there was some interest in support from either a peer or a healthcare provider with a slight preference for in-person, it seems that the majority of folks just want to receive kits and do it themselves. In terms of where they'd like to pick up the test kits or receive them from, most wanted it through a website or pharmacy, and some more of the traditional areas where healthcare is received, such as healthcare providers, were less, there was less interest in that. Only 50% said like a community org or an app, and some non-traditional innovative methods such as bathhouses, vending machines, or sexual partners was definitely something that people had an interest in, but less so. For actually doing the self-test, about 2/3 of folks used the package insert, and 20% actually didn't use anything and just did the test. And this may be an artifact of the fact that COVID was happening. There were many closures, but healthcare providers and community organizations weren't utilized as supports. As this is only preliminary data, we actually don't know what's happened with most of the HIV self-test kits thus far. About 50% of people who've reported any result to us, there's 50% of the test kits have not been used. 33% were used on themselves, and 16% were given away to others. On those that tested themselves or gave away to others, about 30% of the HIV self-test kits have come back as invalid. And this is, we did a little bit of an analysis on this, and the main area was not getting enough blood into the vial, and also not having a control dot or a very faint control dot, which really is actually not having enough blood. Some folks experienced issues with the lancet or spilled the bottle. And we had noticed these high level of invalids early on. So CBRC had created a campaign about HIV self-testing with Canadian Model and Canada's Drag Race Season 1 pit crew, Travis Lanaff, who's a person living with HIV, and he explains the process of doing an HIV self-test kit and focuses on a few key areas, such as the getting enough blood into the vials and how to interpret it, and shows his positive result on camera. So in terms of some key takeaways, there was a good uptake nationally amongst key subgroups. We do need to do some more analysis to really disentangle whether it's the program itself or HIV self-testing that some of the groups were less interested in. And there was high acceptability amongst LGBTQ people in general. In terms of feasibility, there was higher than anticipated invalid results, and this really speaks to the need to front load education about HIV self-testing, as we will often only get one touch point with folks before they do the test. And there definitely was interest in novel methods of HIV self-test distribution, and we need to collect some more data on this. So thank you very much, and I'm happy to take questions.